Dr. Paul here. I've got a young lady with a sore throat, and there may be a little surprise in this one for you. Let's go take a look. Hello. Oh dear, you don't look like you feel too good. So your throat hurts, and I think you mentioned earlier you have a fever, and that was all since last night. She really doesn't feel good. All right, I'm sorry. Well, let's take a look. And this one is perfect. Perfect. And then we're gonna take a look at your throat. So your throat looks pretty red. One more wide and excellent. Very well done. Stick your tongue out and say Well done. You did it. You did amazing. I'm sorry that was rough. Throat swab.
And then we had a question about something on her thumb.
Okay.
She's got this little red thing on her thumb, and it's been there for several months.
Right there. Okay. I see you have really pretty nail polish.
Thank you.
So I'm going to push real hard on that and see if it disappears, because when little lesions are blood vessels, overgrowth of blood vessels, you see how it sort of pops back up? I can't make it go completely away, but almost. So I think that is an overgrowth of blood vessels, something we call a little hemangioma. Now let's look. I noticed you had one on your there. I think you might have scratched that one perhaps. Mm-hmm. Yeah. That's why it looks a little sort of like the skin's been broken, but that might be the same sort of thing. So for the viewers, we've already done the rest of the exam. I've listened to her lungs, felt her tummy. She had a slight tummy aches. It was a little mild discomfort when I pushed on it, but it's soft. And we have to wait for that rapid strep and see what that shows. That turned rapid strep positive fast. Okay, boy, I bet you didn't expect me back so quickly.
No.
The rapid strep usually takes about 5 to 10 minutes to run, and it just like bam, that was positive. So you have strep throat again. I mean, the good news about having strep is we can get you feeling a lot better really quickly, right? Usually it takes about 18 to 24 hours after we start the antibiotics, and you'll feel like a new person. For our viewers, this young lady here, I want people to realize it's not how high your fever is that matters with regards to how sick you are, it's how you look. So if you're a physician, a doctor, I mean, you look like you feel horrible. You know what I mean? And I mean, I know this young lady, she's usually lively and happy and smiley, and she just feels miserable. That's more important for us to notice. You know, like if this wasn't strep, it would be on me to figure out exactly what it was. And you might ask, well, what would you have done? I probably would have done a CBC, complete blood count, just to make sure we're not missing some other serious bacterial infection. So how a child looks, even if it's high or low fever or the parents are super worried or unworried, actually we always pay attention to what the parents say. However, how the child looks is really important. And we're gonna help you feel better really soon. Once we've identified that it is strep, you can use regular penicillin or amoxicillin. We know we're dealing with strep throat, and you'll start feeling better in 18 to 24 hours. I want you to get a new toothbrush in a few days. Sometimes the strep is on your old brush, and then later on you may be able to reinfect yourself. And you're contagious for a day or so, so no school today or tomorrow. She's not even happy about that. Any questions?
Curious what the incubation period for strep is.
Oh, it can be very quick. As quick as a day or two.
Wow.
So if somebody gets infected within a day or two, they can be sick. I think for our viewers, we should give this young lady a big thumbs up. She really was willing to take this one for the team. She doesn't feel well. I think I'll just speak for her. Don't get strep throat. It is no fun, as you can see. Thanks for watching. I'm Dr. Paul.